Right, so this is advanced care planning training. And the thing to remember with advanced care planning is that advanced care planning is to allow people to pass away peacefully where and how they prefer. And to try and achieve this, we have lots of forms and leaflets that are available for you to use. They're on the HCT intranet. There's a little purple icon with a set of hands, and it says end of life. So if you click on there and then go into advanced care planning, on the left you will find all the leaflets that you might want to use with your patients that you see. There is also a template on System 1, which is found under generic templates and is called HCT End of Life Care. So it should be under generic templates. There we go, End of Life Care. So if you click on that, there, right click and open it up. There are 3 sections. The first section is in blue and is for advanced care planning. You need to put all advanced care planning information onto this template, because this is where people will be looking to find information when they need to use your plan that you've made in advance. If it says in red, End of Life Dashboard on it, then next to a box that you're ticking, this means that ticking that box will go on the End of Life Dashboard. Okay? And this automatically informs the GP to add to their gold standards framework meetings. The MCA results should also be added onto this first advanced care planning page. And there is also a box to say if a patient is aware of their prognosis, so that subsequent health professionals don't assume that they're aware of their prognosis. So tick that if they are aware, but just make sure you don't if they don't not yet aware of their prognosis. It could lead to some very awkward conversations. So the next page, page 2, is an advanced care plan continued. Now here we put on a lot of information that we gather when we're discharging people. So preferred place of care, which is often the place we're going to be discharging to. So you can pick their preferred place of care, and then you can add in the little box next to it any qualifying information. So perhaps they'd like to go home, but it's not safe for them to do so, in which case you need to place that information in that box on the side, on the little pen bit. It's also got their preferred place of death if they disclose that to you. And there is a link to the leaflet Preferred Priorities of Care, which we use, which you can print out and use with your patients to discuss what their preferred priorities of care are and what they would like in their advanced care planning. There will also be a link to the escalation plan, which will record what measures patients would or would not like if they deteriorate. So whether they would like CPR, whether they want IV fluids, whether they want antibiotics, those sort of decisions would go into there. There is also at the very bottom a box which is for recording the patient's wishes. So speech therapists and dietitians are using this because we both hold discussions about PEG placements and gastrostomies, quite often well in advance of when they're in the last year of life. But it's a good way for us to get that share that information without having to trawl back through the notes to find out where your colleague has got to in their discussions. So other teams could use that as well. So if you want to have a discussion with another therapist and it's difficult for you to see their notes, that's an ideal place, if it's advanced care planning, to put your information. So the next page is resuscitation. So there are boxes to record if resus was discussed with a patient, or if that wasn't possible, if it was discussed with a carer. This is also where you tick whether they are or aren't for CPR. These decisions can be changed at a later date in either direction. So if they come out of acute with a DNA CPR, they do well with you, change their minds, you just need to check the other box and just record that they've now changed their mind. And it can keep going backwards and forwards as many times as it needs to. So that's the first section, that's the blue section. The next section is section 2, which is the pink section. So if you click on assessment, now this is often filled out in detail by nurses. This is the holistic assessment. So your diagnosis should be recorded here. There is a link to the adult core assessment, which the nurses quite often fill out. There is a separate box down the bottom to record things like bone mets and spinal cord compressions, and that's for reporting purposes. But this is the assessment that you should all be doing with everybody when you initially see them. So record all that information. Then page 2 is symptoms. So this is also in the core assessment. So there are a variety of symptoms for you to tick and record. There's also a link to the pain template, which we all know we need to be filling out. Remember that if the symptoms or pain change, especially if they improve, come back in and record it. Otherwise, we will have out-of-date information saying that they are still in a lot of pain, or that they've got a lot of symptoms, and we might have managed to resolve those either with therapy or medications. So page 3 for the pink section is social history. And this is where you can record if they've got children, if they're young and they've still got children at home. There is a link to safeguarding here, which can be quite useful, save you having to look for it elsewhere. You can also record things like benefits and applications for grants and disabled badges. And there will be a link to the CHC here, but that is being updated nationally, and there will be new guidelines that everyone will be following rather than being local guidelines. And when that is agreed, there will be a link to that. But at the moment, we're waiting for the agreement of what the guidelines will be. So the next section is carer. This is to record formal and informal carers here. And to record if they accept or decline carers' assessments. Also, you can record a care agreement using the template link that's on there. So the next page is page 5, is a summary. So there are 3 main boxes on the summary page. The first one is advice. It's where you outline the advice that you've given. Box 2, outline the plan of action. And box 3, medication review. So that's to record just in case medications on there as well. So that should be message in a bottle as well, is another one of the boxes that needs to be ticked, whether they've got a message in the bottle put in for a later date. So the just in case medications and the message in the bottle are quite important, because when they reach their last days or weeks in life, if we haven't got those set up in advance and they're not put into place in those last weeks of life, we could still fail to give them the end that they would like, and they may end up hurtling off to Lister or wherever in an ambulance because we don't have the medications to deal with their symptoms, and we don't have a message in a bottle to tell the ambulance crew that's what their preferences are and how to deal with any symptoms. So there is also a box at the bottom to say end of life care assessment completed. That will turn up on the dashboard. If you've gone to the trouble of filling out and completing the entire assessment, tick it so that you know that you don't have to go back and do that again at the moment. So the next section is the green section, and this is for the last days of life. So this has several pages to record things like pain management, including syringe drivers, identifying they are in the last days of life, so that will be recorded on System 1 and be able for people who come in to see them, like the doctors and the district nurses, to know. That's also used to ensure that just-in-case medications are available, ensuring equipment that they might need in their last days or weeks of life are in place, plans for stopping things like oxygen or non-invasive ventilation, Plans for stopping food and fluids, especially if they've got a PEG tube. Referring them to support to hospice or palliative care nurses. There should be MDT discussions every third day if your patient is in their last weeks of life. And finally, there is a national requirement on the final page, which is to record the place of death. So it's very important these last days of life that we follow up on the advanced care plan that we've done previously and make sure that everything is put in place, that the just-in-case medications are put in place as soon as we identify that they could be in the last weeks of life. The just-in-case medications can sit around for quite a few months, but if they need them next week or tomorrow and they're not in place, it can make things a little more complicated and less smooth. So finally, there are 3 new alerts that are coming up on System 1, which I can't show you from the template. The first one is a black triangle. This is triggered when the Has End of Life Advanced Care Plan is selected on page 3 of the template. And this is removed when the Not Suitable for End of Life Advanced Care Plan is selected. So that will turn up on your alerts, top right hand corner of your patient's notes. The next one that we're used to is the red DNA CPR. This alert is triggered when the Not for Attempted CPR is selected on the template and removed when the For Attempted CPR is selected. Now that was there before and was removed and is now back there again. And then the last one, we have an egg timer that appears. So when you get to the green section in the last days of life, this alert is triggered when last days of life is selected. This is removed when the suspended from last days of life pathway is selected. So if you see your patient and think they might be in the last days of life, it's best to tick that little box. It's not guaranteed they're going to die the next few days or weeks. If they make a good recovery, go back to their baseline, just untick it. And it can be done as many times as needed. As we know, it's not an exact science predicting when someone is in their last days of life. And like I said, the most important thing to remember, that all of this planning that we're doing is to try and ensure that people get to die peacefully at home with their families or in hospice or wherever they choose, rather than being taken off to Lister with lots of invasive treatments that they've said in the past that they don't want. Thank you.